More capacity, better allocation of care and stronger expertise. Singapore is looking at how its healthcare system can be better prepared when the next pandemic hits. Sherlyn Sia with this report.
From hospitals to clinics, swabbing stations to vaccination centres, it's been all hands on deck for the past 3 years in the battle against COVID-19. The Health Ministry now wants to expand capabilities. For one, it's looking at leveraging the public-private partnerships that were forged during the pandemic.
There was a need really to partner with the hospital clusters to really alleviate some of the pressures they're facing. As a system, we can only have enough capacity if we really have a combination of the skills, the capacity of both public and private to address longer-term issues. And even post-pandemic, the real battle really is chronic disease.
And that's where family physicians can also come in. A government report suggests that by mobilising them, vaccines could be administered to everyone aged 50 and up within 3 to 4 weeks. Singapore will also do more to place patients in facilities most suited for them. For example, moving them from ICU and hospital wards to transitional care or rehabilitation support. This was seen during COVID-19, when new facilities were needed to take in growing groups of patients.
We had to rapidly scale up from a community care facility to a community treatment facility. We had more and more elderly with multiple medical conditions, and during that period to meet this demand, we had to rely a lot on our existing manpower, redeployment, working overtimes, and of course start training new healthcare workers to come in to help with this increasing load and demand.
And so, Singapore will continue to grow its healthcare talent pipeline, including both local and foreign workers.
Gig workers is one option, but one important thing is, especially for professionals who already have resigned from the job, hope they still come back after a certain period of time. We welcome them, and importantly, don't lose touch of the skill set that they have.
That's also where the SG Healthcare Corps made up of volunteers will come in. MOH will ramp up training so that they can step up if additional manpower is needed in future pandemics. The white paper also recommends a legislative review of the Infectious Diseases Act to support more flexible and effective public health responses during a pandemic with ever-changing circumstances. And on a global scale, Singapore will plug itself deeper into networks like the World Health Organization to detect, understand and react to new viruses more quickly.